invite Israel so he can join while he's on his way.
Okay.
Is he close?
Do you want, should I go to him still at the beginning here? Let him do it remotely? Yeah, he did a little bit.
Do you want to wait?
How far away is he?
He's 5 minutes away, about 5 minutes away. Ago.
I've used that line myself a couple times.
5 minutes away, 5 minutes ago. Yeah.
He doesn't give me a time when he sends it. He's supposed to arrive at 9:05. Wait.
Well, that's downstairs.
You get that's with the car. So,
Fine.
let's see.
On my right at the end.
Ready?
Ham and Deidre are ready.
Should I connect them in?
Huh?
Should I connect them in or no?
If you want to, yeah, but I'm gonna start the meeting. Am I good? Start? I'm gonna reconvene the Finance Committee special meeting with our public hearings. This will be our second public hearing as part of our Finance Committee special meeting. We originally convened the meeting on Tuesday, August 8th at 1, with a hearing on August 10th at 6 p.m. and then recessed to today. Will the secretary please call the roll?
Director Deere is absent. Director Harrington?
Present.
Director Robinson?
Present.
Director Story is absent. Chair Ryder?
Here.
And for the record, those directors also present. Director Curry
Present.
and Board Chair Taylor.
Present.
You have a quorum.
Thank you. Let's see. We're gonna go first to public testimony.
We do the presentation usually.
Oh, that's right, we
first.
do. I'm looking at it on here, I'm just looking at it out of order. So we're gonna do the presentation first. Is the CEO on the line?
He is on the line. Israel, can you hear us?
I can. Good morning. With us today is Pam Casera, and she will go over the presentation.
All right, and so I'm gonna hand it over to our Chief Financial Officer, Pam Casera, who also has, our Budget Director, Deidre Watts, with her as well. So, go ahead, Pam.
Thank you, Chair Ryder. And as a special treat today, I'm going to let Deidre go through the presentation. Hi. So we're going to go ahead and get started. Well, we're going to go over a few fiscal 23's accomplishments. So in fiscal 23, some of the accomplishments we've had this year is advanced service expansion at Provident and ACHN with cardiology, general surgery, gynecology, and a couple of others. And we've exceeded the county care member utilization of CCH service revenue target for Q1. And we've given out over 2,500 retention bonus agreements finalized, performed transcatheter mitral valve repair and transcatheter aortic valve replacement. And we have reduced our accounts receivable days from 83 to 54 days and continue to serve the health needs of thousands of asylum seekers. Next slide, please. So some of the key initiatives for fiscal 24. Going into fiscal 24, we're going to continue to expense management with revenue cycle improvements, expand services at Provident Hospital, enhance our recruitment initiatives and job fairs, and continue to go comprehensive service lines for oncology, cardiology, and neurology, and mitigate the impact of redetermination on Medicaid members. Next slide, please. So starting off with the fiscal 24 budget assumptions, we approach fiscal 24 with a baseline of our actual projected volume run rate for fiscal 23. So we're going to continue to increase surgical cases and procedures at Stroger and Provident, continue to ramp up service lines that we're continually working on, which is cardio, neuro, and cancer, and we're going to keep the ED observations and births flat, and we're going to increase the we're gonna increase the county care PMP capitation, rate by 3%, and we're gonna do a 4% charge master increase to market rates for selected services. And then, we will, implement the impact of the fiscal 2023 Medicare IPS, proposed final net impact for Medicare. And then the, county tax, allocation increase of 10 million to cover correctional and public health. And we're gonna, average out the membership we're decreasing the membership for county care to 364 due to retermination. Next slide, please. So for fiscal 24, our volume assumptions, we approached that modestly with, fiscal 23 projections. So we've, taken small increases between 1.5% to 2%, and we're only having the reduction in county care membership due to retermination of like a 17% decline. Next slide, please. So for fiscal 24, the proposed budget that we are presenting is $4.2 billion for fiscal 24. That is $264 million over fiscal 23's budget, but it's coming in at a decrease of fiscal 23's projected revenue. And that's just driven by small changes throughout our net patient revenue and our other revenues, a small decline in county care and the increase in the tax allocation. Next slide, please. So our expenses are coming in the same as revenue because we're presenting a balanced budget. So the expenses are coming in at $4.2 billion, and we will talk about the expenses in the next few slides. But we're also doing a decrease in our FTE. So our overall net decrease in FTEs is a decrease of 308 FTEs. Which is based off of right size and exercise, then vacant position, a combination of productivity, and we're creating a pool for our vacant positions. Next slide, please. So for correctional health, correctional health overall is coming in at an increase of $15 million, and that increase is due to the rising number of detainees needing care, expanding on telemedicine services, the mental health staffing, and programmatic realignment to meet clinical needs for the mental health demands. And then we're doing the decrease in the FTEs, which is 44 vacant FTEs that was removed or retired in 12 reclass to the health system administration for pending needs for the health system. Next slide, please. So our Provident is also coming in at an increase of around 19 million, but a decrease in FTEs of 21. And that's driven by reestablishing our neurology and stroke center services, expanding GI services, women's services, resuming our therapies. And then we're decreasing 10 vacant FTEs removed and 11 reclassed to the health system administration to help create the pool. Next slide, please. So our outpatient services is coming in at an increase of $50 million, a decrease in 77 FTEs, and that's driven by the expanding our virtual care and urgent care to select clinics, radiology services, expanded to Arlington Heights, continuing to serve the health needs of the asylum seekers, and then our decline in FTEs is due to 53 vacant FTEs removed and 24 reclassed to the position control committee pool. So Stroger is coming in, Stroger's coming in a little bit higher as well, and then we're having a variance of 191 FTEs, and we're continuing to ramp up on the service lines that we've been working on, which is our cardiology, neurology, and cancer center, and then some of the increase is driven by inflation that's due to registry, medical, and pharmacy supplies in our utilization rates. And then our vacancies in terms of our positions declining, we have the 87 vacant FTEs that we removed, and we reclassed 104 to our position control committee in health systems administration. Next slide, please.
You're one ahead, Debbie. Did I go too many? There you go. Too touchy, sorry. Public health, yes.
So public health is the top line in, which is in the health fund, which, the health fund has a small, increase of $2 million, here, and then a decrease in, 50 FTEs. And, so the decrease in the FTEs, those 38 vacant FTEs are removed, and 12 were reclassed to the pool, and then the remainder reductions due to grants ending. And the bottom line is just a breakdown of our total grants that we have that fall up under public health. Next slide, please. Health Service Administration. So Health Service Administration, it's coming in at 32 million higher, and then the increase of FTEs of 95. So the increase of FTEs here are driven to the reclasses from across all offices. And we established the Position Control Committee department in this department related to our goals and vacancies, and we also established a clinical research to support research operations in the health system. Next slide, please. So health plan services. Health plan services, the variance for health plan services driven to the claims expense that is driven to the claim expense, and then there's a small reduction in FTEs of 8, which is also driven by the realignment, moving those to the pool to the Position Control Committee. So the projected membership is due to decline due to retermination and resumption in annual state assessments of the auto assignment and the reduction of auto assignment to 35%, and we're going to average out the membership to an estimate of around 364,000 a month, and we'll see the increase 3% in per member per month, and the medical loss ratio estimate is around 92.2%, which is consistent with prior years. Next slide, please. So this is just a graph of the membership. It's just trending on where we anticipate the membership to end up by the end of the fiscal year. So we're anticipating the average around 364, but a projection by the end of the year to be around 348,000. And then this is just an overall summary of the plans of how the county care is broken out. And then this is the total contribution to CCH as well. And that is it. And what's up next is the CCH Finance Committee on the 18th, and then the vote on the 25th. On this.
That concludes the budget presentation. Thank you.
Great, thank you, Pam. Before I go to public testimony, I see that Mr. Roach is here. Israel, do you have anything else you'd like to add?
The only thing that I would like to add is that just a brief summary of the comments we gave when we came in, which was that the budget was built conservatively, but with points for growth on our ambulatory lines where we feel opportunity to expand specialty care, especially in areas that have been underrepresented and communities that have been able to not get access to specialty services. So we continue to grow that. We do have modernization efforts and expansions built into our acute care division, and we were conservative given the changes in redetermination with county care and its predictions. But we do have room for growth. We will be facilitating some great things like a science office as well as expansion on service lines. and continuing investment in our overall, plant and modernization efforts. So, I want to thank our finance team, as well as the county finance, team for being able to work together with us to put forward this budget. And we're, also want to thank the board, for their support and look forward to, the next steps in the process.
And I'd like to know for the record that Director Story just joined us. Next, we're going to move to receiving public testimony. I believe, Debbie, we have 3 people registered for in-person testimony and 2 people registered for virtual testimony. Is that correct?
That is correct.
And no written testimony has been submitted.
That is correct.
All right. So who is our first speaker?
Our first speaker is Maggie Harris. And just a reminder, you have 3 minutes for your testimony, and I'll give you a heads up when you have a minute left, and then when your time has expired.
Thank you.
Good morning. My name is Maggie Harris. I'm a peer at Austin Congressional Black Caucus, also known as Austin CBC. I will briefly share my experience living with AIDS and working with the CHIP network. I was diagnosed with HIV in 1992. Through my journey in life, I have learned about forgiveness, found and opening, and discovered my purpose in life. My life journey is remarkable, resilient, and victorious after overcoming childhood trauma and addiction. I am honored to be here today to testify to the CHIP Network Positivity, Impact, and Further Advocate on behalf of my community. Within the HIV community are shared experience and diversity. But regardless of our lived experience, we all can agree the need for HIV care and place and space within the health care service. The HIV community has always had to fight for a place and space. Research shows that space and place can improve health and care from our own experience as well as mine. I have seen how space begins to take away at Austin CBC has negatively affected the team, the peers, and most notably the patients. A care environment is essential is supplying a patient-centered care. Today, we're still fighting to have a dedicated space for healing and enrichment environment for patient relatives. I, along with the patients, attach hope from care, safely, and wellness to the space at Austin CBC. And unfortunately, we sometimes must cancel support groups and address our mental, substance, and psychosocial needs due not to be guaranteed a space. Unfortunately, as patients, we do not experience facility in having a space and place when receiving our health care. On any given clinic day, my appointment could be interrupted due to my case manager or therapist not having the space or the time to meet with me. Along with the challenges of space at Austin is the increased needs for resources, HIV, and outreach in the Austin community. I do not know where I would be if I hadn't been tested for HIV. We must use our resources to fill the gap in Austin community. The Austin community has experienced dedication of systematic racism, neglect, and misinvestment. As a peer,
Pardon me, 1 minute left.
As a peer, I am collaborating and supporting various community organizations. In closing, I hope those in the room will help us continue bringing the gap by providing a permanent space in place HIV care at Austin Health Center, increasing in resources needed for further HIV testing and outreach within the Austin community. It has been an honor to stand before you today and share my hope for the future for HIV service in Austin community. Thank you.
Thank you.
The next speaker is Sana Sial from the Greater Chicago Food Depository.
Hi, good morning.
Morning.
My name is Sana Sayal. I am Senior Director of Partnership Services and Support at the Greater Chicago Food Depository. We work closely with Cook County Health staff to alleviate hunger in the county. We know that one crucial element to preventative care is nutrition, and at the Food Depository, we believe a healthy community starts with food. According to Feeding America, 1 in 7 people in Cook County is at risk for food insecurity, meaning they struggle to access the nutritious food they need to live a healthy life. Even 1 is too many. Inadequate food access has dire consequences on morbidity, mortality, and the overall health and well-being of children and families. It has been a challenging few years for families. In some ways, the pandemic is behind us, but due to recent inflation, elevated food prices, and the rollback of crucial pandemic-era public assistance programs such as SNAP, many families continue to find it hard to put healthy, nutritious food on the table. It's likely to take many more months, if not years, for households to regain financial stability after the challenges of the last few years. And we expect the need for food to continue for quite some time. The Food Depository is proud to have partnered with Cook County Health over the past 9 years on a number of important programs. Together, we've incorporated food insecurity screenings at all CCH outpatient health centers. Patients who screen positive for food insecurity receive valuable information and resources to access healthy food, including a list of locations where emergency food is available, a referral to our SNAP hotline to apply for benefits, and a voucher to visit the Food Depository's Fresh Truck right at their health clinic. The Fresh Truck makes bi-monthly stops at 11 participating Cook County Health clinics to provide fresh fruits and vegetables to our neighbors facing food insecurity. Over the past fiscal year alone, the Fresh Truck has conducted 64 site visits to Cook County Health clinics and distributed to approximately 6,300 households, representing more than 21,500 individuals this year. On average, around 100 people attend each of these distributions. We're excited that our partnership is evolving to also include an on-site pantry at the Belmont Cragen Health Center, where patients will be able to access nutritious food and meet with a health educator at the very same place they see their provider. The Food Depository wishes to thank you for your leadership and commitment, and we look forward to seeing the impact of the on-site pantry at Belmont Cragen when it opens soon. As you begin the fiscal year 2024 budget process, we urge you to continue investing in this important work that we have achieved together. The Food Depository is committed to this partnership to ensure that everyone in Cook County has the nutritious food they need to thrive. We know we can't do this alone, and we are truly grateful for your support. Thank you.
Thank you.
The next speaker is Angela D'Antonio from Chicago Lighthouse.
Good morning. My name is Angela D'Antonio, and I am a Senior Marketing Director at the Chicago Lighthouse. Thank you for this opportunity to strengthen and deepen our long-running partnership with Cook County Health. You may know that the Chicago Lighthouse has been a critical resource for Cook County residents from marginalized communities since 1906. We are committed to creating a world where all people have the opportunity to reach their full potential. Our programs are designed to provide resources for people who are blind, visually impaired, disabled, and veterans to live as independently and confidently as possible. We assist more than 50,000 individuals each year, with the vast majority being Cook County residents, and we serve people regardless of their ability to pay. Whether we are helping an infant who is blind to learn to navigate a world built for the sighted, or providing a senior experiencing vision loss with a community of support, our work enables people to live healthier, more independent lives and strengthens our community. Our essential services include low vision clinical services that provided more than 4,000 appointments covering low vision rehabilitation, psychological counseling, occupational therapy, and assistive technology last year. Employment programs that empower more than 1,000 at-risk individuals each year to gain the vocational skills and job placements they need to support themselves and improve their quality of life. Children's and youth programs that help more than 200 children adolescents, and young adults with vision impairments and often other disabilities reach developmental and social milestones each year. Our social service programs are fueled by our social business enterprises, which earn most of the revenue that supports our programs. In addition, these businesses have helped the Chicago Lighthouse become a major of people from disenfranchised communities. Currently, of our 655 staff, approximately 35% have disabilities or are veterans, and nearly 80% identify as Black, Indigenous people of color. Cook County Health has been an essential partner to the Chicago Lighthouse. Last year, Cook County referred 216 patients to our low vision services for rehabilitative care that could not be found anywhere else in the region. Meanwhile, Cook County Health has had a call center contract with the Chicago Lighthouse since 2017. This contract provides smooth and seamless appointment scheduling for Cook County patients while creating jobs for Lighthouse clients and enabling us to earn income to support our social service programs. A testimonial from a visually impaired employee in one of the call centers: I like helping people. Being able to help people find the service they're entitled to makes me feel empowered. We are here today to be supportive of the Cook County Health budget. We are a partner and a neighbor in the Illinois Medical District, and we look forward to our continued partnership serving our community. Together, we make an incredible difference for people throughout Cook County, both with and without disabilities. Thank you for your time and your support.
Thank you. The next two are virtual.
That is correct. The first virtual speaker is Eula Burge, who I believe has joined us. Ms. Burge, are you connected?
Yes, I am connected. Can you hear me?
We can. Please go ahead.
Thank you. Hi, I'm Eula Burge, and my journey has led me to start Proactive Community Services. We're located in Flossmoor. I grew up in a disadvantaged community. I grew up in Robert Taylor Project, and I've had a journey. The agency was started because my brother actually succumbed to HIV and AIDS 20 days after diagnosis. It was a scary time. He actually was diagnosed in 1997. There was no resources, and it was very scary. And the only information I could find at that time was through Project Inform. So I knew something had to be done. So ever since then, I've been working to address the HIV and AIDS problems in our community, especially for Black population. So at PCS, we've been around for the last 18 years. We have, yearly we serve about, we're a small agency, Black-led, so, but we do make an impact because we're on the front lines. Last year, we served about 11,000 individuals, getting them tested. We found 17 positive, and we got them connected to care. A lot of times we're sending people to the core center and to other qualified healthcare centers. We more recently became a partner with Cook County Health, and I'm grateful for this opportunity, and I'm really grateful for Jennifer Brothers and to everyone who noticed a small agency in the south suburbs and gave us an opportunity to be funded through the Behavioral Health Initiative for Opioid Prevention. Thank you guys for doing that. Opioid is a spinoff from our HIV prevention program, and we found so many disparities through HIV prevention. We noticed that there's an issue with economics, so there's issues for lived employment, lived wages that allow people to live. We noticed that a lot of individuals are homeless. 30% of the individuals who we do outreach for doing HIV prevention, they were actually homeless or unstably housed. And then there's the substance use. So the opportunity to have the opioid prevention programming is really great. We've been out, we've been in the community, we are working with police departments, the fire departments, we are working with community based other organizations. I've talked to our representative about what we're doing in the community and how important it is, and the fact that we were a smaller agency and the county Cook County gave us this opportunity. And we're making such a difference because, you know, overdose deaths is we really have to address that. And so those are things that I'm really so grateful for. I'm a little jittery. I didn't write out a speech. I usually just try to speak from my heart because this is very, very important to me. And I am indigenous of the population. And when we talk about all the different things, healthcare was an issue for me. I was diagnosed with lupus, which ultimately led me to kidney failure, to eventually having a kidney transplant. So in our communities, a lot of times, the lack of information, the lack of access to healthcare, all of these things is very important that we have a way of addressing it, because it's just all connected with the social determinants of health. And one of the main things that's a driving factor, especially in the southern suburbs, is income, transportation, and just the lack of what people don't have. So we're small, but we're mighty. And I'm just once again going to say I'm grateful for you guys at Cook County Health having the foresight to recognize the benefits of partnering with a smaller Black-led organization in the southern suburbs. Thank you so much for this opportunity, and thank you so much for the opportunity to speak today. And of course, this is my first time speaking really at a public forum like this, and so I'm just grateful for this opportunity. And I just look forward to a long-term partnership with Cook County. Thanks so much, guys.
The final speaker is Katie Eigen.
Hi, good morning. Thank you for the opportunity to speak with you all today. My name is Katie Egan, and I am the Continuum of Care Planning Director at the Alliance to End Homelessness in suburban Cook County. The Alliance leads the Cook County Continuum of Care, also known as the COC. The COC is a diverse network of partners working together to develop, fund, and implement solutions to end and prevent homelessness. On any given night, 1,100 individuals in suburban Cook County are staying in a temporary emergency shelter or sleeping outside on the streets because they have nowhere else to go. Of the individuals experiencing homelessness, approximately 3/4 identify as people of color, 8% are veterans, and 17% are families with children. Cook County Health is a really critical piece of our homelessness response system, and today I want to highlight the importance of our partnership this past year with CCDPH through the CDC Health Equity Grant. The CCDPH CDC Health Equity Grant supports 8 of our COC member agencies that are located in the northwest and south suburbs of Cook County, and they provide shelter diversion and street outreach services to individuals and families experiencing a housing crisis. Shelter diversion is a strategy that includes housing-focused problem-solving services for households to find alternatives before needing to enter emergency shelter. The CDC Health Equity Grant supports 5 trained staff who help households to problem solve and to think through positive housing solutions based on their own strengths and networks. This shelter diversion strategy reduces demand for limited shelter beds, and it allows staff to target our more intensive homeless interventions and resources to those with higher service needs and who have no alternatives to an emergency shelter stay. This past year, 1,900 households have received diversion services through our partnership with CCDPH, of which nearly 40% of those households were able to find an alternative, safe, stable housing solution without ever having to need to set foot into an emergency shelter. A coordinated comprehensive street outreach program is a crucial part of ending homelessness, and the CDC Health Equity Grant supports 5 dedicated street outreach staff, also located in the northwest and south suburbs, who work directly with individuals who are sleeping outside. Street outreach staff build trust. They provide basic need items, including health education and first aid supplies, and ultimately work closely with individuals who are experiencing unsheltered homelessness to connect them with available shelter or other housing interventions that meet their needs. This past year, 950 individuals who are staying outside have received street outreach services through our partnership with CCDPH. Ultimately, we know that housing is healthcare. Individuals experiencing a housing crisis, particularly those who are staying outside or in a congregate setting, need a safe and stable place to call home. And so my ask for you all today is to continue supporting Cook County health initiatives like this that allow us to build a strong, resilient homeless response system that prevents individuals from becoming homeless whenever possible, provides crisis housing whenever needed, and quickly connects individuals with the housing, healthcare, and services they need to thrive. Thank you.
Thank you. Are there any other public speakers?
None that registered, no.
Anyone? All right. That concludes our 2 days of public hearing attendant to our originally called Special Finance Committee meeting from Tuesday, August 8th. Our next regularly scheduled Finance Committee meeting will review and consider the preliminary budget at its meeting on Thursday, August 17th at 9 a.m. With no further business for this special committee meeting, the meeting is adjourned. Thank you.
Thank you.